Hello everyone, I'm Dr. Todd Higginbotham with Higginbotham Family Dental, and we really haven't done this much, but kind of where we're at and the times that we're in, I just thought we haven't got to see our patients, we haven't got to do a lot, and so let's do it. Let's talk to our patients. Let's tell them what's going on. Let's tell them what we know. As I'm working along here, as you watch, ask questions. I'll answer them. I can see them pop up, and we'll talk about them. One of the main things that I want to talk about, though, is when are we going to open? When are we going to see you, our patients? That's the main question that I hear every day, or what services can we provide? Well, right now we're still emergency-based services, which means if you had a temporary come off or crack, or if you have a tooth that's swollen or hurting, that you may need a root canal, or if you have an infection you can see and it's draining and we need to remove a tooth so you don't go to the emergency room, that's what we're here for. And we're here every day for you for those services. The state of Arkansas has said May 18th we are allowed to open. Well, how will that look? It'll be different. It's not going to be exactly how we do business before because we had to change a few things as mandated by the governor's office. So we won't be running at 100%. You can still get your teeth cleaned, but we cannot use the ultrasonics as before. So we'll just be doing hand cleanings only, and they'll be restricted to about one person per hour, and then we'll have spots in between where we clean the operatories, let it sit a moment, and then see our next patient. As for the doctor, we can do more procedures than just emergencies. There's a list of different things, but most things we can do. Now, we can't do full arch rehabilitation. They don't want us to do that yet. But we can do most procedures, including crowns if we need to. So May 18th for Arkansas, that's when we see people cleanings get kind of back to normal a little bit. So in other states, so in our Kennett office, so Missouri is actually open this week. So it's going to be going, not with us, but next week we'll open that. So we took this week to prepare, get all of our PPE in order, and we'll be open Monday there to start doing cleanings and seeing patients. And there's not a whole lot of restrictions in Missouri other than they want you to follow the CDC guidelines. Also on the dental board, they have their guidelines, but it's mostly the ADA guidelines from them, and we'll follow those and the OSHA as we get those newest reports come out, then we just follow as they put them out. Tennessee in our Memphis offices, so May 6th, which was Governor Lee said that we could open back up. So that'll be tomorrow. To prepare for that, we just didn't know it changes every day. So to prepare for that, what we've done is we will open May 11th in Memphis as well. So in Memphis, we'll open May 11th. We'll start doing some cleanings. We'll also start doing more procedures. There's, kind of like Missouri, there's not as many restrictions as, say, Arkansas would have. But it's just, common sense, good judgment, OSHA guidelines, ADA guidelines, CDC guidelines, all the measures that they have indicated we need to do, we will be doing.
Dr. Higginbotham, Janet wanted to know, when you say Memphis, does that include Bartlett?
Yes. So all of our Memphis locations, May 6th, from Governor Lee in Tennessee, he says that is when we can open. So instead of opening midweek, we decided Monday we will open, and so we'll start rescheduling appointments. We'll start getting your cleaning scheduled. And again, we can start doing more work too. We can, if you need an implant or you need a crown or you need a root canal or working on your dentures, we can do those things. So do you have any other questions on here so far?
No. One thing that patients will probably need to know that it's the procedures that are going to be a little bit different when they come to the office. They won't just come in. Can you kind of explain?
Well, we're going to follow the main protocol as we did before. Is so once you come in, you'll call us when you get there. We'll have your paperwork. If you need to do paperwork, you'll do that in your car. And then when your appointment time is there and we're ready to see you, we'll call you. So we won't wait in the waiting room. You'll sit in your car until it's time to come in. We'll have a questionnaire for you, like most places. Have you left the country? Have you traveled? We'll also check your temperature, and then you'll go sit in your room, which is already more than 6 foot apart, so we don't have to worry about that aspect of it. So it'll be a little bit different. It's not business as usual because you can't sit in the waiting room right now. In the future, we feel like that's coming back, but right now, everything will be done from the car, and it'll be strict appointment times and how we seat and how we stagger, just to make sure everyone feels good and safe and can feel good about coming to the dentist appointment and getting some work done.
And HFD has got a new feature where you can just text the actual office number now. If that's convenient versus calling, you can just text us and we'll get that notification that you're in the parking lot.
And we've also started teledentistry. We spoke about that a little bit, but one of the main things that I wanted to let you know about teledentistry is Why use teledentistry over coming in for an emergency? Well, here's an example. Say you're at work and you're swollen. Say it's a wisdom tooth. Say it's a tooth that may need a root canal extraction. Well, you can call, make a teledentistry appointment. Every one of those appointments come through me. You send a picture, and then we have a questionnaire. It all comes through me, and then I discuss it with you. And then if you need medicine there, you don't ever have to leave work. So you get medicine, and your infection goes down. Then we make the appointment to do the work. So normally where you may come into the office, we see the infection, we give you medicine, we wait, then we work. Well, now we give it to you through our telemedicine appointment, and you're ready to work when you come in. So you waste no time. You don't have to leave work or kids, or you just can't get away. I mean, we're trying to make things as easy as possible so you don't have problems. And so you're ready to work when you come in, whether it be extraction or a root canal or implant or whatever you need. So, you see anything else there?
No, a lot of patients are asking if they had a Saturday appointment.
Mhm.
Is that something that they can look forward to again, or is this going to be a Monday through Friday?
So, as all of you know, we've been closed almost 2 months. And it's just, like I said, this is what the governors of the states have made us do. We want to get back as much as you do, I promise you, because I'm not a sit at home person and I'm ready to work. I'm ready to get you fixed, and all the dentists here are. So, I mean, we're looking forward to getting back to it. So,
Okay. I think that's all we have. Is there anything else that we need to let them know about? So we've got Missouri.
Missouri is going to open up May 11th, Monday. Tennessee, all Tennessee offices will open up Monday, May 11th. Jonesboro will open up May 18th on a Monday. And so that's all the opening dates we have right now. If there's any changes, we'll let you know. But for now, that's all we have in that regard, and get back to normal business. And like I said, we're ready to see you. We're ready to get your teeth clean. We're ready to continue with your treatment. There'll be a few changes along the way, but I mean, everybody sees that. We know that now. But we're looking forward to getting back in and working. I know you are too. And a haircut, as you can see. I'm in bad a shape as everyone else, so we'll be looking forward to that too. So.
All right, well, that's all we have. Then what we'll do is follow us on all of our social media for the latest updates. And as we get updates, we will definitely let you know.
Look forward to seeing you.